If you want to improve the fullness and firmness of your breasts, then there are really two options: breast implants and fat grafting. I'm Dr. Victoria Aimé, a plastic surgeon in Scottsdale, Arizona, and today we're going to talk about the pros and cons of each of those. The key difference between breast implants and fat transfer is the amount of volume you want at the end and how much you expect to get. So if you think about it, we have a breast implant. If I put this breast implant into a breast, the volume you see is the volume you get. It's completely predictable. The difference between that and fat grafting is I can put this amount of volume of fat in a breast. We might not get that much. We might get half of that much. So I think the predictability of volume is one of the main factors that's really different between the two. A breast implant surgery works by us choosing our implant size based on your body shape and then inserting it into the breast. And really that can be in a couple different planes. It can be above or below the muscle. A small incision is usually made underneath the breast, but it can also be made in the armpit or just around the areola of the breast. How fat transfer is performed is that we have to do liposuction to harvest fat cells from other areas of the body. Then we process those fat cells to get them ready to implant, and then we essentially just put them around the breast tissue as an injection. Recovery time between the two varies a little bit. So the recovery for a breast augmentation is pretty quick. It's just, this is the only area we're operating on. However, if we talk about fat transfer to breast, then it can be a little bit more of a recovery just because we are also doing liposuction on other parts of the body. But both of them have a pretty quick recovery. So the life expectancy, if you will, of a breast implant surgery versus a fat transfer to the breast is a little bit different. So on one hand, we have a breast implant, and you have to think of this like a tire. So this can wear out over time. It's gonna be in your body, your arm's gonna be moving all around it. This implant can fail at some point down the line if it's kind of worn out, if you will. There used to be an old wives' tale that would happen at the 10-year mark. You have to get your implants replaced at 10 years. That's not really true. Now our implants are made so well that you can keep them for as long as you like until you either have a problem with them, you want them out, you want a different size, etc. So really, you can have breast implants for your lifetime, but if you are a young person, I tell patients, expect that you're gonna have to change them out at some point in your life. If you get this at 25, you're probably not gonna still have the same implant at 75. Whereas when we talk about fat transfer to breasts, the reality is we're taking your own tissue, natural tissue, and we're moving it to the breast. And because of that, it's going to live with you for a lifetime. It's going to age with you. If you gain weight, if you lose weight, it will age with you there too. So fat transfer to breast is more of a lifetime long procedure, and breast implants has more of a definitive lifespan. Some of the most common concerns that I hear from patients about breast implants are, number one, they're worried they're not gonna pick a size they're actually gonna be happy with long term. Did they pick something too small, too big? There's no way to really know or try it on until after the fact. So that's number one. Patients worry about the longevity of their implants. So that can be in the form of an implant that could potentially rupture, an implant that could have capsular contracture, things like that. So I think that those are probably the two main issues that people say with breast implant surgery. A couple of the other nuances people talk about are the fact that they can't hug someone directly because they'll feel the implants, and somebody might know that they have breast implants then. So it's a little harder to hide because it's less natural. Breast implants are very soft. They feel very soft because of the silicone we use in them, but the reality is they don't feel completely natural like normal tissue. So that's another thing that we talk about in terms of what people really worry about with breast implants. And for fat transfer, concerns that I hear from patients are, well, I want to know exactly how much volume I'm putting in. So fat transfer is unpredictable. You might have 50% that retains, and you might have 30% or 70%. And so patients are worried about that. They are worried that they're not going to get enough upper pole fullness. We don't get as much, it's not that the implant is stiff, it's just a little bit more stout of a material, and so we actually can fill out that upper pole. We're not going to get that augmented look with fat transfer, and that's sometimes the look that patients are desiring. So that's number one. Patients are also worried about, what if I gain weight, or what if I lose weight? Will I lose weight in my breasts? So those are probably the three main concerns I hear about fat transfer to breasts. How I help patients decide what option is best for them is really a very personal choice. So I will present the pros and cons of each option with the patient. We'll talk about breast implants. I'll show them a breast implant. We'll talk about, well, if we were to take fat, where would we even get the fat? Have you had liposuction before? Have you had other surgeries? Are you even a candidate? Are there health issues that preclude one or the other? But really it comes down to your personal goals. You know, what look are you trying to achieve? What volume are you trying to achieve? Are you worried that this is a breast implant, or you don't care that it's a breast implant? Those are all factors that go into choosing what is best for each patient, and it is an extremely personal decision. And my job is just there to guide you and present you with the options. And that's why the consultation with me in person, one-on-one, is so important. We can go through what your goals are, what your body type is, what would look proportionate on you, what will give you the most natural result and achieve your goals. And that's why I absolutely love to see my patients in consultation, and why I think it's really important to do so before you really choose one option or the other. So if you're someone who wants fuller, firmer breasts, these are the two most popular options, and I hope that you found this video informative. So the next step would be to sit down and have a one-on-one consultation with me. This can either be in person or via telemedicine if that's easier for you. You can give us a call or text us at 480-550-9493, or drop by our website and schedule an appointment for yourself online, www.metropolitanplasticsurgery.com.